I'm Philip Mason Joyner, one of the incident commanders here at Clackamas County's Emergency Operations Center, and I'm a local public health official. Today is Friday, April 17th. Currently in Clackamas County, we have 150 positive cases of COVID-19 out of a little over 3,000 community members that have been tested, and 3 of our community members have died. Our Emergency Operations Center has been activated for 49 days now, and we had another busy week of accomplishments. We're quickly filling resource requests from healthcare providers, from clinics, from nursing homes, first responders, and others that are providing essential services to our most vulnerable community members. That personal protective equipment is something we want to get into the hands of those frontline workers to protect them. We're coordinating with our hospitals here locally and in the region, working with them to increase testing, as that's one of the tools that we need in order to get through this crisis. The Portland metro area, currently we have lab capacity to run about 1,900 tests a day. We're proactively reaching out to community-based organizations that are serving populations most impacted by this crisis, and we want to make sure that their voices are heard, that we understand what their needs are, and working really proactively to address those needs and help. We continue to have our team focused on working with the hospitals for patients that are discharged from the hospital, making sure that they have a safe place that they can recover from their illness and protect them from exposing others. Earlier this week, Governor Brown released the State of Oregon's framework for how we will reopen our communities and our local economy. The elements are needing to see a decline in the growth of active cases, sufficient personal protective equipment for our frontline healthcare workers. We are closely monitoring our hospital bed capacity and looking at that closely. We know that we're going to need a strong public health workforce. We're going to need robust testing. We're going to need strong disease investigation work in order to move forward. And we know that we really need to focus our efforts on protecting those that are most vulnerable. Clackamas County, we are doing a great job of flattening the curve. Our local hospitals, they aren't overwhelmed right now. The challenging part is that we do believe the stay home, stay healthy order is something that we're going to have in place a while still in order for us to implement all of these elements within the framework effectively. Clackamas County is leading the way around planning for recovery. We know that this is something for our economy, for the health of our communities we want to see. We also recognize that this incident is changing our community, that it's not going to be just going back to normal. Our ultimate goal moving forward is that we have a more resilient, a more equitable, a safer, and a healthier community after we get through this incident. We continue to hear from residents asking every day what they can do to help. First, I want to remind everyone that what you're doing right now, the hard work you're doing to stay home, to follow those physical distancing guidelines, we've shown that it is making an impact, that is working, that sacrifice is really critical and important. So while it might not feel like you're doing anything, you absolutely are. And it's making a direct impact on protecting our frontline healthcare workers and the most vulnerable members of our community. And we understand how difficult this is and how stressful this is. Folks feel isolated. As we head into another weekend, we want to encourage everyone to think about what you can do to help others, to make connections when you can, when you feel that you safely can. Reach out to folks, reach out to someone you haven't talked to or connected with in a while, perhaps a neighbor, a friend, or a family member that you can connect with virtually or the phone. From a far physical distance. You have the opportunity today to lift someone's spirit up, to provide them with hope, and that would be one action that we hope that you can do today to improve someone's life.